Hey there everyone, in the previous video we had studied about the femoral artery, femoral nerve and the femoral vein, its definition, contents, boundaries and everything with the diagram, so please make sure to watch that video if you haven't seen. In this video we are going to complete the clinical anatomy of the whole chapter. So we are going to start with the Holden's line. What is the Holden's line? We had already studied in the previous chapter, okay, previous series of the videos. Okay, it is between the Holden's line is the line between the deep membranous layer of the superficial fascia of the thigh and the deep fascia. See, this is the superficial fascia and this is the this both is the superficial fascia and this is the deep fascia. The line between is it's the Holden's line. What is the condition? When urethra is injured in the perineum, the urine flows out in the membranous layer of the superficial fascia. So if the urethra is injured, the urine will flow in the membranous layer, then it will travel to the abdominal wall, then it will go to the upper part of the thigh. Okay, but what is the significance of the Holden's line is that the Holden's line, it does not allow the urine to flow further. So this is the significance of the Holden's line. Okay, now we are going to see the injury to the femoral nerve. If the injury to the femoral nerve occurs, then sensory loss will be seen on the anterior compartment of the thigh and to the leg foot till the base of the toes. Okay, and this is due to the injury of the femoral nerve. Now injury to the lateral cutaneous nerve of thigh, what happens? It causes severe pain. Okay, it causes severe pain to the lateral side of the thigh, and this condition is called as the meralgia paraesthetica. How do you remember this name? I have created a mnemonic by myself, which is quite funny. So it is the Mera Pyara Aesthetic laptop. Okay, Mera Pyara Aesthetic, you can remember meralgia paraesthetica. Okay, and laptop, why? Lateral cutaneous nerve of thigh. See, there are two more nerves, that is the medial cutaneous nerve of thigh, intermediate cutaneous nerve of thigh. You should remember which cutaneous nerve of thigh it is. So laptop, lateral cutaneous nerve of thigh, so it is meralgia paraesthetica. So Mera paraesthetic laptop for lateral cutaneous nerve of thigh. Okay, now we are going to see the regions of the pain. See, femoral nerve injury for the anterior, for the leg and the foot and till the toes. This is due to the femoral nerve injury. Sensory loss will happen. And to the lateral cutaneous nerve injury, there will be on the lateral side there will be pain, which is called as a meralgia paraesthetica. Now we are going to see the fascia lata. Okay, clinical anatomy of this. It is the extension of the thigh. Extension of the thigh pulls the abdominal wall downward, right? See, when you extend your thigh, the abdominal walls muscles or content will be pulled downward and makes it tense. Okay, to release the abdominal wall, the patient draws his legs to like close to his body. Why? Because the physician wants to do clinical examination for palpation and all. So the patient draws his leg towards his body. So this helps the fascia move upwards and it makes it easy for the physician to do palpations. Okay, so this is the clinical anatomy. And iliotibial tract. Okay, the iliotibial tract, it can replace the ruptured muscle tendons. Okay, this is a surgical procedure that's seen. Now femoral hernia is an important topic. The femoral canal is the area of potential weakness in which the abdominal contents may bulge out, causing femoral hernia. See, if the abdominal contents, if they are bulging out in the femoral canal, then it is called as the femoral hernia. Okay, common in females. Why it is common in females? Because in females the femoral canal and the pelvis is wider than in males and the vessels are smaller. That is the reason the femoral hernia is very much common in females. See, the hernia contains of a neck and a sac. So if this is the hernia, this is the neck of the hernia and this is the sac of the hernia. Okay, now what is the cause of hernia? See, course of hernia. See, it arises in the femoral canal, then it goes to the sphenius opening. In the sphenius opening we have vessels, right? The epigastric vessels, the pudendal vessels and the circumflex iliac vessels. So it can go there and it can go there and cause hernia. Okay, now the strangulation of hernia, it is done by the surgical procedure. Okay, the femoral ring has to be enlarged, which is done by cutting the lacunar ligament. See, there is femoral ring. So suppose this is the femoral ring, to the medial side we have the lacunar ligament. By cutting the lacunar ligament we can enlarge the femoral ring and saving the hernia. In case of abnormal obturator artery. If the obturator artery, if it is lying close or if it is going along the lacunar ligament, it is called as the abnormal obturator artery. And during the surgical cutting of the lacunar ligament for enlarging the femoral ring, if the abnormal obturator artery is cut, okay, it causes dangerous hemorrhage. Okay, so this is the clinical significance of like whole hernia. Okay, now what is psoas abscess? Okay, the tubercular infection can travel to the lower limb, okay, between the psoas muscle and its fascia. It reaches behind the inguinal ligament, can be mistaken for the lymph node enlargement. So see, the blue one is the psoas major muscle and the pink one is its fascia. Okay, the tubercular infection can reach in between this and cause enlargement. The doctors can mistaken it for the lymph node enlargement. Okay, this is called as the psoas abscess. Now what is so the intermuscular injections are given in the anterior lateral region of the thigh. Which muscle is present on the anterior side? That is the vastus lateralis muscle. तो इसके नाम में ही है, so it is easy to remember. Now femoral pulsation can be felt. Okay, so it is not much in detail. So the femoral pulsation can be felt because it is a superficial femoral artery, right? Now compression of the femoral artery is done to avoid excessive bleeding. Okay, excessive bleeding, to avoid the excessive bleeding, the compression to the femoral artery is done. The femoral artery cannulation. What is cannulation? It is insertion of the cannula or the thick needle. Okay, see, since the femoral artery is superficial artery, can be easily ligated, tied, cut, and passing cannula, for passing the cannula and all, it can be the cannula can be passed and it can be easily ligated and tied because it is superficial. And catheterization is also done till it reaches the heart for performing minor surgeries. Okay, this is called as the femoral artery cannulations. Okay, now positive sign of Nairth. What is this? In the hip dislocation, in case of the hip dislocation, the femoral artery also dislocated, and if the femoral artery cannot be palpated, then the positive sign of Nairth is seen. So this is the significance. And now we can see the femoral nerve block. So the local anesthetic injection, if it is given into the femoral nerve, it blocks it. So this is called as the femoral nerve block. And what is adductor canal block? Adductor canal for the sphenius nerve. Okay, for the sphenius nerve, local anesthetic injection is given below to block the sphenius nerve. So this is called as the adductor canal block. Now what is adductor canal compression syndrome? See, if there is hypertrophy of the surrounding muscles, okay, it causes femoral artery to get compressed, and it also causes the sphenius nerve to get compressed. So suppose this is the canal, okay, so this is the adductor canal, and the surrounding muscles, whatever, if there is hypertrophy, okay, hypertrophy, this compresses the adductor canal, and the contents within the adductor canal will also be compressed, causing the femoral artery compression and the sphenius nerve compression. So the femoral artery compression, it gives the claudication symptoms like muscle pain, weakness and nausea, and the sphenius nerve compression gives neurological symptoms. Okay, so this is all about the clinical anatomy or the applied anatomy of the complete chapter. Thank you for watching.